Since we are running short of time, I'll just focus only on the operation theater standards and few safety mechanisms. So I have no financial interest in this topic. I just work with NABH on a honorary capacity and passionate about it, and based on your and our interest. So basically, you all know that, this basic things make a difference. An optimal OT should be situated in an area above OPD, less crowded, and it should support the other systems like patient safety and infection control. There are certain management related issues. One is the medication management, then equipment management, and personnel or human relations management. The whole thing comprises the operation theater management. So this is the often repeated question whenever we go for assessment. We've been operating in this setup for so many years, nothing happened. Why should we have a layout? Why should we have a system? Why should we follow a standard? The reason is manifold. One is approval by the government and professional bodies. And now with Clinical Establishment Act coming to the vogue in many states, it is necessary that we have a system in place. It improves safety for patients, providers, and staff. It improves the quality and image of the hospital. It saves on maintenance costs for people who are really cost conscious. It saves on maintenance costs, the chemical cost, and the human relation cost, and safeguard from the medical negligence case as well as cost. So NABH has categorized operation theatres in two major categories. One is the super specialty OT, another one is the general OT, and this general OT includes the ophthalmic theatres, and that includes daycare operation theatres. So we are under the general OT category. And this is the basic assumption kept in view for all OT standards. A standard occupancy of 5 to 8 persons, equipment load of 5 to 7 kilowatts, and ambient temperature and humidity at each location to be considered. So basically, we need to know the structure, process, and outcome for the operation theatre management. The infrastructure is critical. Superstructure, including the human resources, is really necessary. And the process from admission to assessment to procedure and then transfer out of the theatre is also important. And we also need to focus on the documentation aspect of it, data, the audit, and results. So OT planning, the design should support the function. There should be functional segregation of OPD so that there is no mixing of patient flow. And we need to separate this. This is the only critical area in eye care institution. So we need to separate this from the general traffic. The design and structure, again, have to support the equipments as well as disposables as well as regular maintenance. So basically the form should follow the function. Ideal zoning is to have 4 zones, the outer zone, restricted or clean zone, then the aseptic zone and disposal zone. So this is the major area of non-conformance in many of the eye hospital because mixing of the layout and the zones. So ideally there should be 4 well-defined zones, whether it's a single theatre or a twin theatre like this. So you can have any floor surface, but it should be hard with less joints. Hard marble or marbronite is enough. People always keep on asking this question whether need to have a modular OT or not. It's not necessary. You just need to support your function. So the OT walls, door lighting, so ideal is to have a dust proof or moisture proof OT walls, and the door has to be 2-leaf or self-closing, and then with good natural as well as general lighting, and with separate scrub and sterilization. You can't have the scrub area inside your OT. So this is very, very important. So I'll just focus upon a few areas of concern in eye theatres. The objective of ventilation system in the OT is to dilute the bacteria. Air maintenance is very important in this regard. We need to have clean air inside the OT coming in, and there should be proper air exchanges available. Another objective is to create an airflow pattern. That's where the laminar flow and air handling unit helps. And this also provides a comfortable environment for people working. Many theatres, we all work around at least 6 to 8 hours in the theatre. The operating team personnel, not only the doctor, the staff has to be really comfortable. So air handling in the OT is really necessary because air when supplied through the HEPA filter, the return air is also picked up by the racers, and this is the advisable HEPA filter mechanism down to 0.3 microns, and it should be a dedicated one. You can't share with other areas. So this is the ideal physical parameters for operation room ventilation. So whether you have a air handling unit or not, it should be well fumigated and aerated. There should be continuous air purifying mechanism. Temperature should be maintained around 20 to 23 degree. And humidity is also very important. People don't really consider this aspect because fire do happen anywhere, and in our country we need to maintain humidity also. So 30 to 60% is the ideal range. And air movements from clean to less clean areas. All this can be easily done with your existing OT. We need not really go in for major changes. For entry level, any good system to maintain clean air and ensure air exchange is acceptable. We are not really focusing on air handling unit or laminar hood above your operation theater table. So a HEPA filter is not mandatory, but ideal is to maintain the air parameters. And this again a detailed view of why humidity control is necessary, because we use lot of lenses. Our microscope have lenses, in retinal surgery we have lenses. So when moisture forms on the operation equipment and other surfaces, there is always static current, and this pulls in all the debris and particles. So bacteriological microorganism again follows with this low static current, and so this has been proved that low relative humidity is suitable for Klebsiella pneumonia activity, and high humidity enhances growth of Pseudomonas. So we need to maintain optimum humidity to avoid all these issues. And you need to clean the storage tanks also. You need to have some mechanism for regular cleaning and validation of this cleaning process. And we often see congested operation theater, single room OT with all this stuff inside the theater. So it's always better to have a well designed, adequately spaced and equipped sluice room to have all these support structures. So why quality assurance and sterilization necessary? Because it's a legal requirement, and it's also a requirement for various empanelment, and it reduces medical and surgical errors, better infection control, and basically it improves the safety. Maintenance again is over a period of time is very easy and cheap, and saves you from medical legal cases. So I'm not here to teach you anything, so just a recap of whatever you know already. And sterilization again is dependent upon machine and humans, both are capable of error. So we need to have a system in place to reduce this human error as much as possible. So with that I conclude, and request Dr. Sunita to come and give a talk on how accreditation standards can help in clinical excellence.